In multiple myeloma, patients are not yet homogeneous. There are multiple subgroups of patients who are not clearly defined and approached in clinical trials, and they need special consideration. Among these are extramedullary disease, renal impaired patients, and also the toxicities which are appearing now more often requires attention, such as infections and other toxicities. So in this session, we will be talking about an unmet need, extramedullary disease, and Philip Morrow is going to talk about that. And we have seen so far that despite all the improvements in therapy and response rates, even in the early relapses and diagnosis, there are patients such as extramedullary disease. Their responses are not so good. And in the EMN19 study, which we have done, completed, and it's going to be published soon, we have shown that at diagnosis we can reach deep responses, including MRD and also metabolic response in the bone lesions. The rates are lower and inferior to the other patient profiles. So Philip Morrow is going to talk about it, and I have seen that in the program he has another abstract which directs this subgroup. So it's going to be very interesting. We are hoping that there will be new data that is hopeful for this high-risk group. On the other hand, renal impaired patients who are under dialysis, and the new treatments such as the bispecifics and CAR-T therapy, new data is emerging. So Dr. Auro, she will be talking about on this topic, which I think is important since we see about 20% of patients who are in such conditions, and the question should be, and how should we give monoclonal antibodies and bispecifics for these patients, and how can they be monitored is an important topic, and we will hear about that. On the other hand, bone lesions, which will be targeted by Evangelos Terpos, is important since myeloma is a bone disease. It has many effects on the bone with a wide spectrum, and the newer treatments are certainly effective on the bone remodeling, and the new guidelines deserve attention. And finally, Dr. Heinz Ludwig, who has published the recent International Myeloma Working Group guidelines on how to approach patients in this regard, is going to talk about this topic. And immunotherapy today is very effective in terms of redirecting T cells towards the malignant cells, but on the cost of sparing the immune reactions towards the infections. Thus, we have the problem of emerging emerging newer and infections which are not something we used to see earlier, and reactivation of viruses, bacteria, and these require careful attention.